Life Sciences Innovation Northwest, and I'm here with Jennifer Dent, who is the president of the BioVentures for Global Health, a organization that I would venture to say is quite unique in its role and its impact. So I'm going to ask Jennifer to tell us about the organization, how it got started, but I'll also be interested in the pathway that brought you there, because you have an extensive experience in pharmaceutical and life sciences industry. So Jennifer, tell us about, let's start with the organization. What is it, and what does it do, and how did it get to be what it is?
Sure, thanks, Jack. So BioVentures for Global Health was founded out of the Biotechnology Industry Organization in 2004. And the mission of the organization at that time was to create programs and opportunities to engage the biotechnology industry and pharmaceutical companies as well into global health initiatives, because there's just so much that industry can offer when it comes to improving global health. And we had a real focus on diseases of poverty or neglected tropical diseases, malaria, tuberculosis, at the time that we were founded. The organization still has a similar mission today. We've gone through some changes, but we're still very closely tied to the Biotechnology Industry Organization, with Carl Feldbaum, the past president of Bio, on our board, and Jim Greenwood on our board today. And so we work closely with Bio in our initiatives to work through Bio to engage pharma and biotech in global health. Some of our core programs today are partnerships with organizations like the World Intellectual Property Organization, WIPO. We manage a consortium together with WIPO that includes 8 leading pharmaceutical companies to gain access to their assets, intellectual property, compounds, compound libraries, technologies, and to facilitate the sharing of those assets with researchers in nonprofit institutions as well as academic institutions who are working to develop new medicines, vaccines, and diagnostics to treat neglected diseases.
Jennifer, let me just interrupt you there, because that's quite fascinating. We don't typically think of these companies as being highly focused, highly competent, but not in the sharing business. So
right.
How does that happen?
Well, I actually think, Jack, that there could not be a better time than today to engage private industry in global health. I mean, BVGH was formed in 2004, but here we are in 2013. And if you look at Big Pharma, of course, they have an obligation to return value to their shareholders. So there's a profit-driven focus to their business. But at the same time, people working in the pharmaceutical industry truly care about patients and truly care about improving health. And with the markets, the typical growth markets for pharma and biotech being in the United States, in the 5 big European countries, those markets are projected to be relatively flat over the next 10 years, 3 to 5% growth predicted. And so when you look at the emerging markets, those have been a focus for pharma for a number of years, where there's growth between 10 and 25% in countries like China and India. But when you look at countries like Africa, or African countries, there hasn't been a real pharma and biotech haven't really been involved in those countries. And I think BVGH presents an opportunity now, today, for pharma to start to build relationships across those borders and into new markets that they really haven't had an interest in the past. And we're working on some programs today that are building relationships between leading pharmaceutical companies, biotech companies, as well as academic institutions, with researchers that are working in Kenya, Nigeria, Ghana, and South Africa as well.
So that helps clarify the motivation of the companies. Tell us about the mission of BioVentures for Global Health. I can't get the straight.
Yeah.
But not the plaque on the wall, but how you would express it to an interested ant. What's this all about?
We're all about partnerships and taking a very hands-on approach to understanding what companies are willing and able to share comfortably with researchers in the developing world, or researchers that are working on tackling some of the the problems in the developing world. So we work in a way to work very closely with pharma biotech companies to build partnerships with academic institutions. So it's really all about identifying the need and identifying what can be shared to help to fill that need. And so we take a very hands-on kind of matchmaking approach.
Oh, great, great. So you're occupying this very strategic position as the leader of this organization, kind of connecting the huge world of global health and the huge world of life sciences and pharmaceuticals and biotechnology. What are some of the key things in your career that enabled you to take that position?
Yeah. So I think, Jack, really my career has been spent primarily with big pharma. I spent over 10 years working for Roche in a number of different areas. And so I understand the motives of private industry. I understand what their goals are, what they have to achieve to be successful. But I also understand how to present opportunities. What are linking the needs in global health in a way that makes participation in helping to solve those needs acceptable to private industry, I think is really key. And pharma's changed in the last 10 years as well because they have a real focus on global good and improving global health. So I think it's a great opportunity to kind of match what they want to do and presenting a package, presenting a program that becomes attractive to them to participate in.
So let's talk a little bit about this conference and this community. BioVenture for Global Health is actually situated here.
In Seattle,
Seattle.
Yes.
And so is this a good place to be? And is this a good conference to participate in?
So Seattle is a great city for BVGH to be based in because it's really become the hub of global health for the U.S., if not the world, with the Gates Foundation here and with PATH here. And this conference is actually a great opportunity for BVGH to really start to build a stronger network in Washington State. So get to know some of the companies in Washington State and to learn a little bit more about their technologies and how they could participate and become more involved in global health. I'm moderating a panel tomorrow that is all about partnerships, and so we'll talk about the value of partnerships between private industry organizations and nonprofit organizations.
Oh, good. Let me ask you one more question. If you were coaching a 17-year-old who might be interested in a career in this, increasingly complicated and wonderful world, what are the kind of things you would advise in terms of types of experiences, types of education, and just generally suggest that person consider?
So what's really exciting too is that so many academic programs are really looking at the opportunity in global health, like Northeastern University, who have a hub here in Seattle now, and Emory University has a big program that's led by Dennis Leota, kind of a renowned person in biotechnology. And so I would encourage them to look at the academic opportunities to become involved in programs where there are exchanges with research institutions or institutions in African countries. And if you can actually take advantage of spending some time in Africa or developing world countries to really understand some of the challenges and issues that they're facing, I think that is going to create a real passion and a real desire to help to solve those problems. Because what we're seeing so often is when I've presented at Stanford, for instance, to their medical school, a little bit about what BVGH does, and students will come up afterwards and say, how can I become involved? So the younger generation really cares about improving global health. So I would just say kind of increase exposure.
And the old Husky in me would want to say the University of Washington also has some good programs in global health that students might also want to consider.
They actually have some great programs, and we've actually worked pretty closely with some of their faculty.
That's good. Well, it's terrific that you're here at Life Science Innovation Northwest, and thank you so much for spending time with us, and thank you for what you're doing. You're helping build a better world.
Thanks so much,
Appreciate
Jack.
it, Jennifer.
Thank you.